Good afternoon, people. My name is Dewey Admiral Fanning III, and I'm excited here today because today is my first day of my awesome podcast. And we're going to be doing this now, and it's just super exciting. But right now, I have an amazing person that I'm so excited to have with me here today for my very first podcast. His name is Dr. Jordan Stewart. What's going on, Dr. Stewart?
What's up, man?
Hey guys, Dr. Stewart, man, he's a board certified foot and ankle surgeon. He's the Timonium Foot and Ankle Center. How long have you been doing this now, Doc?
I'm in my 18th year of practice, believe it or not.
Oh, so there, he's board certified. Dr. Stewart he treats a wide spectrum of ankle conditions, and in fact, he successfully operated on my wife, which she's also here today as a special guest. But we are going to focus on Dr. Stewart today, and also we have with us Mr. Tanner Sparling here today, which was referred to. From Dr. Stewart to my wife, and then from my wife to me, an amazing story that you really have to see. Hey guys, we're going to talk about obesity and being overweight and how it contributes to a significant impact on both physical and mental health. Although medications such as Ozempic, bariatric surgery are helpful tools and fixing some of these problems, but we know these are not permanent fixtures. And we know that one of the major permanent fixture or help preventative way is through health and fitness, dealing with nutrition as well. So we're going to say that we know that fitness and nutrition is the major keys into fixing when it comes down to being overweight or things of that nature. So guys, we are fortunate here today to have Dr. Stewart because he recognized this in his practice. And he's just an amazing guy. I can't find a better person as a doctor or surgeon and a major friend, and we all stand with Israel.
Thank you.
Hey, Dr. Stewart, welcome aboard. You are my first guest here on the Admiral Personal Training Podcast, man. Thank you so much for being here today. I do want you to go back, and I'm sure I missed some of your.
You're good, man. I appreciate you patting me on the back, and I'm gonna really share some great successes with you and Elaine. I want to just kind of briefly talk about what I do, just so everybody understands. I have a practice, Timonium Foot and Ankle Center, located in Timonium, Maryland. And I am a podiatrist, and I treat a variety of foot and ankle conditions. And, it's important to understand that the foot and ankle are connected to a body. And what that basically means is when I treat patients in my practice, I don't just look at the foot and ankle. There are many medical problems that really have a significant impact on the foot and ankle. And recognizing that and treating the entire comprehensive spectrum of medical problems is really beneficial when we treat our patients. If you have a patient that comes in and you just look at the foot and ankle and you don't look at the fact that they're carrying 50 extra pounds on their body and they have heel pain, you're probably going to have a hard time getting rid of that heel pain. So in my practice, I really take the approach of, I'm not a primary care physician. I'm not a bariatric surgeon. I'm not a nutritionist. I'm not a dietitian. I'm not a pharmacist. But I feel that if I'm not doing my job, I feel that I'm not doing my job, and I feel like I'm doing a disservice to my patients if I'm not helping them manage their other medical problems. You mentioned already, Ozempic, Mounjaro, Wegovy, some of these weight loss medications, they're getting a ton of press. And listen, they have their place. There are patients that need those medications. I can't tell you how many times a patient comes into my office and I look on their medical record and it says bariatric surgery, and I'm looking at them and they're weighing 400 pounds. And, I asked them the question of, did you lose weight when I had bariatric surgery? Yes, I lost 200 pounds and I gained back 180 pounds, 200 pounds. It's very, very common. Those surgeries have their place. I did a podcast in the past with a bariatric surgeon, and there's definitively patients that do well, and there's definitively patients that have recurrence. And it's very important for physicians to address weight. The problem is it's a very touchy, uncomfortable topic. People are extremely sensitive about their weight. It has a lot of physical and mental impacts, and it's a dicey situation. And I have to be very gentle. I have had many patients get pissed off at me, not want to look at me, not want to talk to me, write me a negative Google review because I talked about their weight.
Could you tell the truth?
Well, I tell the truth. And listen, I'm not immune to it. During COVID, I was probably 15 pounds heavier than I am now. Before COVID, I was in great shape. I hit 40 years old, and, I started gaining some weight, and, I started working with you guys as well, which I appreciate. But, it's super important when I see patients with foot and ankle pain and I see them carrying 5, 10, 20, 30, 40, 50, 100 extra pounds, that I can't ignore that because it plays a role in their recovery. Diabetes is a major medical problem. It's a major epidemic in this country. There are kids coming in with diabetes. I see kids with pre-diabetes and diabetes who are teenagers. And this is, it's horrible, and it's scary, and it's sad. It's quite sad. But if we don't address the issues, we have problems: gout, hypertension, high cholesterol, diabetes. I'm really excited, Dewey. You already mentioned that we have a special guest with us tonight. And Tanner's an awesome guy, musician, brought us to this cool studio today.
Yes.
And, Tanner is one example of many success stories. We have a lot of patients we've done together. Tanner came to me several years ago. And he had plantar fasciitis. And Tanner, what did you do at that time after we treated you for the plantar fasciitis? What was part of your treatment at that time?
Part of the treatment at that time, thinking back now, orthotics and staying off it a little bit for a while, and some bracing, a few other things.
In addition to that, what did you do with your weight at that time years ago?
So I did lose considerable amount of weight after that got better, about probably 50, maybe 60 pounds, all of which I gained back. And then some. So this most recent time.
Well, hang on. Let's stop for 1 second. So Tanner came to see me several years ago, and we talked about weight at that time, and he got the message, and he did it. And he
did it on my own that time.
He did it on his own, and he lost weight on his own. And he went through that cycle that we just mentioned a little earlier of losing weight, getting his foot pain better, and gaining weight back. However, you gain the weight back and you gain more weight back, okay? And this time you came to see me and you had ankle pain, but you also had another problem. You had a new diagnosis of type 2 diabetes.
Correct, yeah.
And you also had a very high A1C, an elevated A1C. For those of you who don't know, A1C is a measurement of the blood glucose over the course of 3 months. You're looking at the hemoglobin that gets glycosylated, and we look at that number as a percentage. And if that percentage is, above a certain number, you're diagnosed with diabetes. If there's another number, you're a controlled diabetic. In our diabetic patient population, we like to see that number below 7, ideally even closer to 6 or even closer to 5. Tanner, you were at 12 when you first got diagnosed. Okay.
Correct.
And you saw your primary care physician initially. And what did I don't treat diabetes primarily, but there's a reason we're going to share this. What did your primary care physician focus on in treating your blood glucose?
Yeah, primarily it was medication to try and manage that diagnosis. So there was a little bit of talk of, maybe some lifestyle stuff for nutrition and, mainly just trying to lose the weight. But
were you given the tools of more important?
No, with this, we're talking literally a 20-minute office visit. It's only
right. So Tanner came to see me, and he came in with his ankles hurting, and quite frankly, I didn't really care too much about his ankles hurting. I'll be very honest. I wanted to get your ankles better, and I did care about your ankles hurting. But your diagnosis of diabetes with an elevated A1C of 12 really scared me. Yeah. And I was worried for you, and I really spent a lot of that visit talking more about how you need to talk to a nutritionist. What was your response to that? You know, think of yourself, you're just to jump ahead a little bit. Tanner's done excellent. We're going to get into that. He's lost a lot of weight. His A1C is awesome. His blood pressure is awesome. His cholesterol is awesome. His blood works better than all of ours at the table. And, you know, but I want you to put yourself back in the shoes when you were heavier and facing that diagnosis of diabetes. What was your response when I talked to you about, you know, you really got to focus on nutrition? We didn't talk about too much exercise. We talked about nutrition.
Yeah, definitely.
How did you feel about that? Because some patients don't like it. What was your sensation at the time?
Yeah, I mean, I was already, you know, I already was working on it, I'd say, in kind of air quotes.
But you were stuck.
Yeah, I was definitely stuck. And I was also at the time relying on Ozempic for, you know, appetite control and some of those things. And it played its role for a while, but, you know, I definitely was seeing that that's not what was going to get me toward, you know, my end goal, which is losing a significant amount of weight and resolving the diabetes diagnosis. Yeah.
How did you feel just, you know, when a lot of patients come to me and they're very reluctant to call nutritionists. They don't like it.
Yeah,
they don't like, you know, it's just a common response. People naturally get defensive or they don't like the feeling of someone pointing out a problem that they have, even though it's really the benefit of trying to get the diagnosis.
But it's not that. It's just that a lot of overweight people think totally different. You know, overweight people don't think like someone's fit. A fit person has a totally different thinking conception than an overweight person. So basically, you thought like an overweight person. What do an overweight person think? They think about what they're going to eat, you know, what they're going to watch on TV, what they got to do that day. But fitness is not in that agenda. So that's what I'm saying. So
basically, when he recommended, I thought at the time, in my mind, first gut reaction was, I have this under control. And I think I even told you that. And then you slid it into the conversation, you know, a couple minutes later. But here's the number anyways. Maybe you should call. And
I did not push it on you.
No. It actually wasn't pushy at all. But it was the fact that
weight person thing.
It was the fact that you kind of repeated it a couple times that made me think maybe I should consider that and see just if that can get me, you know, over a hump and get me somewhere, you know.
So Tanner took the first step, which is important, and a lot of patients are very reluctant to take that first step. But the ones that do, it is exceedingly rare that we don't see a good result. And that's where, you know, we'll come back to discussing some things with Tanner. But, you know, I think that there's no doubt that there's a psychological component. You know, Tanner, you and I were talking off camera a little earlier. You know, you said to me before, when I was carrying extra weight, I didn't want to take a picture with my family.
No, I literally skipped family photos.
Right, you didn't feel confident. How has your sense of confidence changed?
Like night and day.
Right.
Yeah.
So when you're talking, when I'm talking to patients about trying to lose weight, they're in the mindset of oftentimes depression, denial, pain. You know, it's a vicious cycle, and you know, it's very easy when you're in pain to sit around and eat. And, you know, again, I focus on the foot and ankle conditions, but I really focus on the comorbid medical problems that come with it. How's your blood work now? Your A1C was 12. What is it now?
5.
I
just got it done 2 weeks ago. Yeah.
5.
That's amazing.
Beautiful. 5 is
explain to that. Yeah.
So 5 is a very normal number. Okay. Again, I'm a specialist that deals with diabetes. I don't actively treat blood glucose, but I treat the adverse effects. Diabetes causes many problems. It causes kidney disease. I worked in that wound care center at GBMC Hospital for years. I amputated more limbs than you want to hear about. Poorly controlled diabetes leads to numbness in the feet. It causes circulation to be significantly diminished to the feet. It leads to wounds. It leads to hospitalizations. It leads to many medical costs. We're going to go on that in a second. Let's talk real quick about your labs. Your blood pressure.
You forgot to say death.
Death. It leads to death. Okay? It leads to things. People who have amputations, partial amputations of their limbs. Your mother. And patients that have an amputation statistically related to diabetes. Statistically, in 3 years, 50% of those patients are dead not because of the amputation, but because the disease state is advanced. So controlling your medical problems. How's your blood pressure, cholesterol, triglycerides? How's all your numbers?
Yeah, everything has come down, like, gotten better significantly.
And we often hear, I often hear patients saying, well, I can't afford that. I can't afford that nutritionist. I can't afford the trainer. Well, let's talk about, listen, you don't have to come to me. You don't have to go to Elaine. You don't have to go to Dewey. This is not about promoting just us. This is about promoting positive health. If you truly can't afford it, which people truly cannot afford everything, you can do things on your own. However, recognize that there are massive cost savings of losing weight. What are the cost savings? How many medicines are you off? All of them?
Yeah, all of them.
Okay.
Yeah.
How many doctor's visits do you have? A lot less or a lot more?
Yeah, a lot less.
A lot less. How much more free time do you have?
Yeah, definitely more free time. And
When it's kids.
And I'm focusing my time on
your kids
fitness and health and
your kids. And
enjoying
you also told me that you couldn't run around and do things with your kids before.
Yeah, absolutely. Yeah.
You're saving time, you're saving money, you're even saving money on food. Why are you saving money on food? Because you're doing what? You're prepping your food. So this is all about proper lifestyle. And what I really want to focus on, this is a team approach, okay? I work with Elaine, I work with Dewey often, I work with other providers, medical providers, and we all, one of my best friends is a pain management doctor who's next door to me. And every single solitary day, we have the conversation of, I have the weight loss conversation, the patient gets annoyed. I have the weight loss conversation, the patient comes in 3 months later, they've gained 10 pounds. They're worse. It's just a recurring theme. It's not the only theme, but it is a very common recurring theme for all of our problems. Elaine, you are a nutritionist, you are a pharmacist, you're a friend of mine, you're a patient of mine, you're a great success story in many ways. You've lost and kept weight off for many years.
Yeah.
I look up to
95 pounds.
95 pounds. I look up to you.
Overall.
Elaine has helped me dial in my nutrition. As I stated earlier, I ran into a patch of struggling, and Elaine has guided me to nutritional success. She's guided a lot of my patients. She's guided a lot of my friends. She's a great resource. Elaine, many of my patients say to me, Elaine's not my nutritionist. She's like my psychologist or my psychiatrist. And I think that kind of bleeds into the topic of, we were talking about this earlier as well.
Right.
What is your main, what do you identify as the main issue that people struggle to lose weight? Is it they're just eating the wrong foods? Is it like they just don't know what to do? Is it that they're like eating at the wrong times? What's the theme? There has to be a theme, because I see a lot of themes. Do you see a theme?
It's really a combination of all those things. More when people think about coming to a nutritionist, they just want to know, what do I eat?
What do I do?
Just tell me what to eat.
Mm-hmm.
And that's part of it, of course. Having a healthy lifestyle, that's part of it. But the problem is that we all know how to lose weight, but we don't know how to keep it off. Keeping it off in the long run.
Keep it sustainable.
Doing things that are sustainable, that they can adhere to for a long period of time. If this is what I tell you to eat right now, can you see yourself doing it in a year? Well, 6 months, in a year, 2 years, 3 years. If you can see yourself doing it in 3 years, you're in the 5% who are actually successful.
And that's hard. And listen, I have to practice what I preach. I'm going to pat myself on the back because I practice what I preach. Thank you, Dewey. And they practice what they preach. And Tanner's practicing what we preach. This is not, we're not trying to paint this picture of, you're going to roll out of bed, you're going to do this, do that, and you'll be fine. This is work. I mean, this is a job. Every Sunday, I cook the same food for the whole week so I can be consistent. I ride my bike several days a week. I work out with Dewey. I stay consistent. If I have an injury, I work around the injury. This helps my mental health. This helps my physical health. And it helps our patients' physical health, our patients' mental health. And we're not suggesting by any means that people become bodybuilders or you're not going to always.
You want to be healthy. Just
healthy.
You want to be healthy.
Correct.
You don't want to be going back and forth to the pharmacy getting medications. You don't want to be having 2 doctor's appointments every week. You
And
know,
we see that there are many people that come in and they live in the doctor's office. So I really think that, you know, what I can highlight that, Elaine, I have had many people come to me crying, literally crying, thanking me for referring to you, because you've kind of, you know, there is a big mental component to this that you've been able to break through. So if you're going to work with a nutritionist, whether it's Elaine or someone else, recognize that behavioral changes are really the key to the long-term success. You know, when I first started working with you, I would say, what do I same thing, same
Right.
questions.
Sounds typical.
And really what I just recognized is, you know, I know what my body can and can't tolerate. You know, I was one of these lucky kids that I was skinny growing up. I could eat whatever I wanted. In college, I could eat whatever I wanted. And then I hit, you know, 35, 40 years old, and, you know, it changes. So, you know,
Yeah, wait till you hit 50 and 60.
so let's talk about there's of course another piece to this puzzle, and you know, I appreciate Dewey bringing me in today, and I want to highlight, you know, myself, my wife, we worked out prior to training with Dewey. We've been training with Dewey. In January it'll be 3 years. You know, I knew Dewey back in the day when he worked out at when he worked at Brick Bodies before he even had his own gym. And, you know, I would see Dewey and I'd look at Dewey in the gym, and he was a big, you know, big muscle guy, you know.
handsome, ruggedly handsome.
Handsome. But, you know, truthfully, when Dewey first approached me about doing some training with him, my cousins actually worked out with Dewey, and they said they loved him. But I looked at Dewey and I said, this guy's a big muscle head. He's just going to push me and make me lift heavy weights and hurt my back and do all this stuff. And Dewey, you know, a lot of people they're intimidated, especially if they're not used to exercising. You know, you have a lot of clients that are young and used to working out, but you also have a lot of clients that have never touched a weight in their life and they've never worked out. And, you know, I would like you to kind of share with us, when you first start working with someone, how do you approach the person that's afraid to walk in the gym, or how do you make them feel comfortable? You know, Dewey, for everybody, and for people who don't know Dewey, they see the videos of him, you know, with his sunglasses and his head over his ear and he's lifting weights, but Dewey's a big teddy bear, okay? I mean, when it comes down to it, Dewey's a big teddy bear, and don't let him fool you, okay? How do you make those clients feel comfortable that they're going to come to you, achieve their results, and not, you know, get hurt and be comfortable doing what they're doing?
Well, first of all, you have to build a rapport. You know, you have to build an instant rapport. You have to make that person feel comfortable. Everyone's different. Mm-hmm. You know, everyone has a different agenda. Everyone has a different goal. But, you know, at the end of the day, everyone wants to be fit and get better. And, you know, and that person, you know, that client or that potential client, you know, what's going on in their head is, what can this guy do for me, or what can this person do for me? You know, so it's about me understanding their needs, helping them get into that mindset, and helping them, you know, understanding what has to be done. But to, you know, they has to be able to trust you. And how do you do that? You know, you create a serious rapport. And I become friends with my clients, you know, because I care, you know. And then once that person can sense that they care, they were like, oh, this is the guy for me, you know. And I've been doing this for 42 years now. So it's not like it's my first rodeo.
Talk to us real quickly. You know, Elaine focuses on nutritional counseling, you know, trying to really dial in eating enough protein, balancing the fat that you eat, you know, eating carbs in the proper portions. You know, talk to us about why, real briefly, talk to us about, you know, what you really focus on with muscle, and why it's so important to build muscle. You know, as we age, Elaine always throws this statistic. Hit me with the statistic. When we age, how much muscle do we lose?
It's 1% a year.
1% after 40,
Yeah.
and in our 50s, 1% every year.
So why is it?
However,
Okay,
can
I'm
I
sorry.
just
Yes,
say,
I'm
once
sorry,
you
yes.
hit 60, though, that doubles.
Oh, it's all downhill.
It's all downhill.
Dude,
from
it's
there.
all downhill, man.
Oh, I still got abs.
So the question to you, excuse me, is how do you focus on building muscle in someone who's not used to doing it?
So, like I said again, basically they have to understand what has to be done. So we sit down and I explain to them exactly what they're gonna do. Everyone knows how to lift weights, everyone knows how to train, but a lot of people don't know how to hone in on a muscle. And when you get someone, you actually able to teach them, educate them on what to do, how to do it. They're like, oh man, this crap really works. And then after they repeatedly do it over and over and over again, then they'll see, progress.
It's an addiction.
And then not only that, I make it fun,
Yep.
And then like I said, I'm not here to sell anything, but, I have a private studio, it's a home studio, private studio, and, you get the best training in the world, which is from me. But you must have to understand that person, what that person needs, understand that everyone's different, and you have to listen to that person because that person is going to tell you exactly what they need. And then once you, open-minded and you understand, you listen to that person need, and once I'm able to give that to that person, then that person say, okay, I'm going to work with this person. Why? Because I can trust this person. That person understands me. And I'm sure that's what, how we built that rapport with you.
Yeah, 100%.
You understood, you was cool as all. We really clicked,
Yeah.
from day one.
Yeah, we connected on the music stuff right away. And
absolutely.
Well, that was one thing when I recognized you were in a band, rock band. I said, "Oh, that's it." That's it.
Tanner, I want to point out one other thing that's important that I would say that Dewey's very good at is that you came to me. We talked about your glucose that we were concerned about. You really came to me not even thinking that I was going to talk to you about that. You did come to me actually for your ankles.
Yeah.
And Tanner was actually having a real ankle.
You found the root of the problem,
Right.
Which is so cool.
Right. So we addressed the root of your problem, which is your weight. Okay. But you came to me with ankle problems, and Dewey told me you were going to start working out with him. I didn't even know you were introduced to him. Elaine introduced you.
Yep.
Okay. But I put restrictions on you.
Yeah.
So it's also important. I'm going to kind of segue for 1 second and say that when you have injuries in your body, whether it's your foot or your ankle, whether it's your knee, Elaine, I did your surgery on your foot. We fused your big toe joint. You had some issues with that. You worked out during that recovery. Why? Because I modified your workouts. Tanner had problems. We modified his workouts. So it's important to understand that Dewey recognizes when people have limitations, you don't tell them to sit on their butt and do nothing, but you work out around, you pivot around the injury, pivoting around the injury. So you did well. And how did your workouts go around your injury?
We made insane progress.
We didn't even do leg work for me.
Yeah, even with the restriction that we had to work around, crazy progress.
So, the bottom line is this.
And now it's feeling better. And now I'm
That's
able to keep, adding in some additional stuff.
So the bottom line is this, okay? We're a team. We have a great success story of many patients. Tanner's one success story.
Multiple patients.
And we just encourage everyone out there to recognize that, health, fitness, mental health, they're all interrelated. Your physical health, your mental health, you do the best you can. None of us are perfect. We all enjoy food, okay? And you have to treat yourself once in a while, but it's the consistency, it's the behavioral part of it. It's the discipline of working out.
The mindset.
It's the mindset. It's the discipline of managing your overall medical problems.
Consistency, man.
And that's how it works. So listen, man, this was an awesome podcast. I'm so happy you had me.
Yeah, but hey, you're gonna most definitely be back. I mean, most definitely you're gonna frequently come back because we want to continue. We just don't want to be one and done. We want to continue to have you on, Dr. Stewart, because we feel that if we just can have one person each time that we speak and let it grow from there, again, Tanner, another great success story. Dude, about 20 more pounds, that's gonna be 100 pounds down.
Yeah,
that's another human
insane.
being.
Yeah.
It's amazing.
My wife, she's lost 95 pounds, but like again, she was able to keep it off. Tanner, he's able to keep it off. Most people can lose 40 pounds, and then you look at them 2 years later, and they're 50 pounds heavier. So again, guys, we appreciate it. I'm the Admiral, man. I'm a personal trainer, 42 years of experience, and this is so awesome to have board certified Dr. Jordan Stewart of Timonium Foot and Ankle Center.
Thank you, my friend.
My man. Again, my beautiful wife, she's a nutritionist. She's awesome. Again, when y'all are ready to get some serious results, man, give us a call. Or if you have someone that have the knowledge, the experience, and willing and care to work with you, hey, you go for that. Again, I am the Admiral, and we're about to sign this thing off.
Have a great night. Thank you.
Peace.
Thank you.
All right.